So there's the right way to engage your core and there's the wrong way to engage your core. I've just put together a stoma and exercise starter guide, and that basically outlines the first step that I help my stoma clients with. So I'm not going to go through all of this text. You guys can read this in your own time. Obviously, you can pause the video and just read it, or you can download the guide yourself. But here's what I want to point out. When we talk about core activation, guys, there's two main ways that we can think about core activation. There is the wrong way, which is the bracing, and this is the conventional wisdom. If you go to any personal trainer, you go to the gym and say, how do I engage my core muscles? This is the one you're going to learn. The opposite of that is what I do recommend, and this is essentially the first step to learning how to basically move more confidently, and that is hollowing. And what that is gently pulling your stomach inward. So it's the opposite of creating that outward pressure. It's actually pulling your stomach muscles inward, engages them, and it's far safer for somebody who has a stoma. And the rest of this guide is basically a step-by-step method on how to achieve abdominal hollowing. We start with step one, which is just learning how to breathe correctly, lying down. Then we talk about how to hollow. And I have this very simple step-by-step guide there. And then then we talk about how to re-engage breath whilst engaging your core muscles. And then once you've learned how to hollow lying down, it's about how do you do it in other positions, such as standing up and sitting down on a chair. And then throughout life, you can use this mechanism of core activation, but the right way to activate your core, essentially that's what that is.